All use of data and disclosures, also known as DUAs, must always follow HIPAA guidelines. They also must follow the privacy rule and be covered by any of the 5 areas defined by the Health and Human Services, such as disclosing to the individual, disclosing for treatment, payment and healthcare operations, for example, billing to the insurance for payment. They must use and disclose with the opportunity to agree or object. They be incidental to use and disclosure and or serve public interest, such as reporting the spread of a disease like Zika or HIV. Patients are afforded the right to opt in or opt out when it does not pertain to the previously mentioned 5 areas. An opt in means that you must affirmatively choose to have your records exchanged in the HIE. If you do nothing, your records will be out the HIE. You may choose to enter the HIE by exercising your opt in choice. An opt out choice means that some part or all of your health files are already in the HIE by default. If you do nothing, your records will stay in the HIE. You may choose to stop this by exercising your opt out choice. It is imperative that we match all patients with a respected record. In order to do this, we all need to follow a 2-step verification process, such as asking the patient for their name and date of birth. All associates must also scan the patient barcode and confirming a match before doing any procedures on the patient or providing any type of medication. The barcode will be located on the entry door and on the patient wristband. If a barcode is not provided or the scanning device does not work, you can ask for an additional patient identifier, such as either their social security number, address, or phone number. When it comes to releasing information, the patient must make the request in person and fill out the required request form. An authorized legal guardian may also fill out the request on behalf of the patient with adequate proof. When picking up the request, the Health Information Management Associate must ensure that the signature lines are signed and the entire paperwork has been completed. Once the Health Information Management Associate has checked for any errors, the patient will then pay to pick up the copies. Copies may also be requested from providers and for legal requests such as subpoenas. HIM Associate must then follow the policy and procedures given in the handout to ensure compliance is being met. All release of information must be compliant with facility, state, and federal policies and regulations. Data transmission and communication include email, fax, and regular mail. When sending any of these forms of communication, we must adhere to all the data transmission policies and procedures. These policies and procedures are guided by the HL7 standards, which allows the exchange of patient care and clinical information and ensures the safety of the health information exchange. The health information exchange is a vital part of the data transmission because it is improving the quality of care and outcome of the patient and reducing medical errors. When we exchange patient information, the data, all employees must be knowledgeable of the steps needed to take to ensure confidentiality and privacy measures are being met. Response to data security incidents is crucial. A data breach is the unauthorized access, acquisition, use, or disclosure of protected health information. If you suspect or realize the security or privacy of protected health information has been compromised in any form, immediately notify the HIM department. Report everything that you are privy to, such as the nature of the breach and individuals or systems impacted. Remember that time is of the essence in this situation. After reporting the breach to the HIM department, other stakeholders will immediately act to lessen the extent of the breach. An investigation will take place to determine the exact number of individuals impacted and whether data was identifiable or inaccessible. Upon any conclusion of an internal investigation, Valley Developmental Center will notify impacted individuals, the media, and the Secretary of the U.S. Department of Health and Human Services as necessary in accordance with the HIPAA breach notification rule.